Hey, it's Dr. Toker. I was asked to give one more clarification video on the concept of surgical masks in the face of respiratory illness. It's interesting, last night I watched on TV, I'm a big fan of Tucker Carlson, and he did a little piece on this, and I think some of what he said was true, and some of it may have been true, unrelated. So the average person should probably know this information. On the one hand, he was accurate. He had mentioned there's a shortage of masks, both particulate masks called N95 masks and surgical masks. Now, these are two different types of masks, and they serve two different purposes in a medical environment. And that part he didn't really clarify on. And unfortunately, the general population equates these two things to be the same. They're really not the same. It's sort of like the difference between a truck that you can move your home with and a, little Pontiac or something like that you can go from A to B in. Like, they're both automobiles, granted. They serve two totally different functions. And so these two mask types serve different functions. So a surgical mask is simply something that protects the patient from you, the surgeon. So when you make a wound and there's an open wound, you don't want to breathe into this wound because you'll cause an infection from just sort of the bacteria on your body. You don't want to touch these wounds. That's why surgeons wear gloves and masks and glasses and whatnot. The first mission is to protect the patient. Now, some of those objects do protect the surgeon from splashing. So if I'm in the operating room and I get into something that bleeds and blood comes squirting at my face, it's not going to go up my nose. I'm wearing a mask. It's not going to go in my eyes. I'm wearing glasses. But the second that fluid hits, you have to take off this mask, because the fluid will soak through the mask, and now whatever illness the patient has is in direct contact with the mucosal surface of you. So these surgical masks are designed to be used and thrown away, used and thrown away, used and thrown away, because they don't form a true barrier. It's a physical barrier for large particles, I guess is the best way to put it. Physical barrier, large particles. But it is a porous substance that fits loosely on your face so you can breathe. So viral particles, which are too small to be seen by a regular microscope, are not impeded by a surgical mask at all in any way, shape, or form. If someone sneezes on your face, that instant fluid to your face is partially protected by this mask, but not fully protected. And if you leave the mask on, you're simply just leaving contagion right in front of your face that ultimately you are breathing in. So does that sort of make sense? That a surgical mask is what you see people walking down the street in. Why are they walking in those masks and not the N95 mask? Couple reasons. They're more easy to get. They're easier to get. Number one. Number two, you can breathe in them because they loosely fit. And they're less expensive. Why? Because the material is not as filtering as an N95 mask. Now, an N95 mask we use for respiratory isolation. So in other words, if you wanted to prevent a respiratory illness, the N95 mask that we use in the hospital is helpful, albeit not foolproof. And again, for it to work, there can be no air coming around the mask. It has to fit extremely snugly to your face. And if you've ever worn one properly, where it's well fitted, it's extremely hard to breathe. I would never want to operate in one of those masks because you just cannot breathe through it. Number one. Number two, it only filters 95% of the particles, not 100%. So there's some manner of viral contagion that will come and go. And then thirdly, they too are designed for one-time contact and then you throw it away. And the real reason is when the front surface of the mask gets contaminated by a sick patient coughing on you, it is sitting this far from your face. With time, especially if it's a wet substance, it's going to soak through the filter of the mask, rendering the mask no longer usable. It's no longer effective. Okay, so let's say you're wearing one of those N95 masks, and it's covered with all kinds of bad stuff, and you take the mask off and put it down on the counter instead of throwing it away because it's a rare commodity and it's expensive. The virus can live on the surface of that mask for many days, and it's a cloth material. You cannot sterilize it. If you tried to wash it, it would disintegrate, would no longer function properly as an N95 mask. So therein lies the problem. For that mask to remain effective, it cannot be in contact with contagion and then be reused. Now, some doctors in the hospitals are wearing N95 masks, and over that N95 mask, they're putting on a surgical mask, because the surgical mask will at least somehow blunt some manner of particulate matter, someone sneezing on them, and get particulate matter off of the N95 mask. It's still not suggested you do that. I mean, the CDC has pretty clear guidelines on how to use an N95 mask, and you really should not reuse it. One of the outrages of this particular shortage is that people are resorting to reusing, and one of the ways they're resorting to reusing is by putting a cheaper mask on top of the more expensive mask. And I cannot say that that is the way it is indicated, nor can I say that will prevent the person who's wearing the mask from getting infected. Furthermore, these things are all getting cross-contaminated the second you touch them to remove them. So there's a concept called the fomite. What the hell is a fomite? Fomite sounds so terrible. A fomite is just a foreign object that's contaminated with contagion. So if I sneeze into my hand and then touch doorknob, that doorknob is now contagious for days, as it turns out. So it's serving as a fomite. It is a vector of contagion for as long as it's sitting there with that contaminant on it, and no one has, if you haven't cleaned the surface. So the problem with reusing a mask is that it is a porous substance that you cannot clean, that is serving as a fomite vector for contagion if you use it more than one time. Is that clear? I don't know if that's clear or not. So, masks, surgical mask, not protecting you from getting this virus. Protecting you from splashes is what it's doing. It's protecting spittle from your mouth going into open wounds and infecting a patient. If you are a sick patient and you're sneezing a lot, that mask may protect the people around you a little bit from at least getting direct water droplets, okay? N95 mask is more designed for aerosolized airborne contaminants. Reasonably effective, which is why we use them in a medical setting. But if you try to use them for a prolonged period of time, or if that mask itself gets wet, it is no longer functioning as an N95 mask. If it's loose around the edges, or if it has holes in it, it is not functioning as an N95 mask. And that is the danger when people start reusing them out of utility because we have nothing else. You may not be helping yourself. So I think that's the confusion, why people are saying, don't hoard masks for you and your personal use. There are doctors who need to use them and throw them away in between each patient. And so if there's not enough masks out there because of a supply shortage, the doctor's having to reuse the mask, and that doctor is going to get sick. And it's happening all the time. You, the individual, walking down a sidewalk, is accomplishing nothing with this mask. If you're in an elevator for the next 15 minutes and you're trapped and you want a mask, that probably has some validity to it. So if you're in a close proximity with someone, the mask may help you from people sneezing on you. But if you're by yourself in social isolation, no need for a mask. If you're walking down the sidewalk, no need for a mask. If you're in a big open building and the next closest person to you is 20 feet away, there's no need for a mask. If you're in a tiny little space and you're going to spend 15 minutes with that person, if that person is sick, you need a mask, which is why the healthcare professionals need the masks, because by definition, they're working with sick people. Does that help the confusion? So So I know it sounds like contradictory information, but it truly is not contradictory information. It's all in how you use it, right? I would not try to move a piano in my Nissan Rogue. We would use my husband's F-150 for that. Does that kind of clarify it for you? So masks, that's them in a nutshell.